Addressing hearing loss and depression could be some of the easiest ways to reduce the risk of developing dementia, according to a new series of scientific papers. For the first time, the papers focused on the Western Pacific region, which includes Australia, China and Indonesia and Vietnam. The area is predicted to have half the global cases of dementia by 2050.
For the first time, a set of scientific papers is looking at the risk factors for dementia in the Western Pacific region. The area has 20% of the global population, but is predicted to have half the world's dementia cases by 2050.
Clearly there are genetic issues underpinning the process, and so we know, for instance, that diabetes, hypertension, smoking, some critically important modifiable risk factors are more prevalent in the Western Pacific region.
With 66 million people in the region estimated to have depression, treating the condition could be key to reducing dementia cases.
It affects people's quality of life, and it also affects their capacity to engage in the other health behaviours that are really good for your brain, like social engagement, physical activity, etc.
It's critically important that we offer screening for hearing and vision for the population and make it accessible.
AFL players are what many consider to be invincible. Yet retired Sydney Swan star Jude Bolton is at high risk of dementia.
It's one of the biomarkers in terms of the Lancet report is traumatic brain injury, and probably 6 major concussions across my career.
He also has a family history of dementia. He witnessed his grandmother, uncle and aunt die of the disease.
Mum and dad and all the aunties and uncles and the like were trying to pull together and be there during their toughest times. So it's just been awful to see that.
The Western Pacific region, Australia's corner of the world, will soon become the epicentre of a global dementia crisis. We're expected to make up half of the world's cases by 2050, despite only being a fifth of the world's population.
It's a very large group. It has a relatively low incidence of dementia compared to aged countries like Australia, but the trajectory is, pretty daunting.
Neuroscience Research Australia's new roadmap is calling on Australia to play a critical role in leading dementia care, prevention and research.
Australia is culturally diverse and at a community level we're not doing enough.
In his last game, Panthers legend Royce Simmons left his mark.
He will remember this for a long, long time.
2 years ago, he was diagnosed with Alzheimer's after a road trip with his wife Leanne.
She got out with a carton of beer and I said, "God, great, you bought a carton of beer for me." She said, "We just pulled up at the hotel and you went in and ordered it and I carried out the car. You just seen it 2 minutes ago." And I said, "Oh."
He's tackling the disease head-on with simple steps such as exercise.
About 40% of risk factors are modifiable, so we can improve or actually prevent dementia.
The experts at Neuroscience Research Australia, or NeuRA, with the list that could help stop many new cases.
You're looking after your blood pressure, your cholesterol, exercise, staying engaged in the community, treatment of depression.
Launching a new roadmap to end dementia. The Albanese government is also tackling surging numbers.
We've added 3.9 million minutes of care per day into aged care.
I do a lot of balancing things. I do anything that I think that's even that much of a chance of helping a little bit just to prolong things,
New research and a first-of-its-kind roadmap to end dementia in the Western Pacific claims 40% of cases could be avoided by addressing risk factors like hearing loss, sleep disturbances and social isolation.
It's estimated around 420,000 Australians are currently living with dementia, and without some kind of medical breakthrough, that number is set to almost double over the next 30 years.
But this is a terrific reminder that there's more we can do.
New hope also on the horizon, with 2 targeted Alzheimer's therapies already approved in the US, currently being assessed by the TGA.
Rolling out those therapies in a multidisciplinary clinic is the critical step to move forward.
We need to fix it. We need a cure. We need help.
Audrey Lee met her husband Jack when she was 18.
Probably around the age of 68. We started to notice things were changing with him.
Despite showing many of the symptoms, he was never officially diagnosed with dementia before he died.
We probably could have done some things that would have helped him, but didn't know.
Now researchers are hoping to prevent other people experiencing the same, coming together to present a roadmap on how to tackle dementia, not only in Australia, but for the whole Western Pacific region.
I think first of all we need to make sure that everyone in these populations have access to a service that can allow them to at least get a dementia diagnosis.
The plan outlines 4 key actions. Use culturally appropriate national dementia plans across all 37 countries in the Western Pacific region. Develop education focusing on modifiable lifestyle risk factors, speed up diagnoses and expand support services for carers, and prioritise regional research. When it comes to lifestyle, researchers say 40% of new cases could be avoided by education on modifiable risk factors.